Are you a dentist that would like to help more patients, have more fun, make more money without working more hours? That sounds a lot like me. I'm a dentist who tries every day to do just that. Patient-centered production, help my team build an awesome, positive environment in our office, be as productive as possible, but not work more hours because dentisting hours, they're a bit like dog year hours. As Paul, Dr. Nacho Goodman, I've created a program to help with this. I'm going to share with you about this program and also the 9 words to millions of dollars. If you just watch this and learn these 9 words, you can produce millions of more dollars in your dental career in a patient-centered way. I live by this mantra. If it doesn't help, it doesn't matter. Patient-centered production can help the patient, the team, and most of all you. But how do you unlock this ability to get treatment plan acceptance? Dental school does not teach us to do this, but we can at Dental Nachos with our Fundamentals of Implant Dentistry program with case acceptance chips. But I have a special assistant here who's going to help me with the 9 words to millions of dollars. Could you bring our fancy technology over, please, moderator? You want to come say hello? Can you say hi to everyone? Oh, this is the moderator of Dental Nachos. I have a question. Why aren't you in school today? Because of the virus. Because of the virus, school is now in our house. So it is a nacho nuts time on earth. So whatever we can learn to make things less nacho nuts would be helpful. So this is the 9 words to millions of dollars. What we have here is a missing 2 space. Moderator, can you hand me the red marker? Thank you. Great job. So what are the 9 words to millions of dollars? We have a patient with a missing tooth. I draw just this for the patient, okay? And I say, hey, my job is to tell you what happens if you do nothing. If you leave this space be, nod to Dr. John Kois, who helped me learn that early in my career. Patients do not accept solutions to problems they do not have. An amazing piece of advice. So we need to create problems for this patient with this missing space. So I also say, after I review all the menu options, just like a restaurant, even if you decide to do nothing, we can still be friends. Always gets a laugh, diffuses the tension, but I want to share with them, here's what happens if you do nothing, select no treatment. First 2 words of the 9 words. This tooth here is going to super erupt, but I don't say super eruption because no one cares about super eruption. We'll tell you what word I use in a second, but not a dentisting word. This tooth here is going to mesial drift, but I also don't say mesial drift because no one cares about mesial drift. They care about what mesial drift means. And I'm going to tell you that in a second. This here, bone is going to atrophy, but I don't say atrophy. I say something different. This tooth over here may break down. I ask the patient, what's your favorite sports team when sports are allowed to be played? Right now, the NBA is in a bubble. It's kind of all we got. If the Sixers had 5 guys, even though they've been eliminated from the playoffs at this point, if they had 5 players, 5 on the Sixers, 5 on the Lakers, and the Sixers lost 1 player, those players on that team would get tired and break down, just like your teeth without missing one of their players. So what are the 9 words here? Tooth up here, falls down, not super erupts. Tooth here, tips over. Bone shrinks. Other teeth break. So if you make your missing tooth, not implant, missing tooth consultations about the 9 words to create a problem for a patient, to share with them what happens if they do nothing. Fall down, tip over, bone shrinks, other teeth breaks. Those 9 words will change your life, the lives of your patients, and the lives of your team. It will create an opportunity for you to do more patient-centered production. Then I go into the menu of treatment options. RPD, bridge, implant. They can do no treatment, risks and benefits, RPD, risks and benefits, bridge, risks and benefits, or implants. When you share treatment like a menu at a restaurant, it allows the patient to see all the options and make the best decision, not for you, not even always for their teeth, for them. Sometimes it's no treatment, sometimes it's a partial, sometimes it's an implant. This is the foundation of what I do with case acceptance and treatment planning. Talk to patients like people, and magic will happen. I want to share with you a little bit about Fundamentals of Implant Dentistry, a course inspired by an amazing dental student at D4, Tyler Tolbert. Tyler came to Philadelphia for our My First Implant course, where we plan, place, and restore an implant. We place an implant on a live patient, get to do models, suturing, case acceptance. I teach it with one of my awesome mentors and friend, periodontist, who helps us learn over a course of 2 weekends how to do this and get started. It's not all the things you need, it's how to get started. We've had awesome notchers take this program. Tyler asked, is there any way we could create that virtually? And we've done just that. We will have 5 hours of on-demand Nacho C on how to extract teeth, bone graft, place implants, plan implants, restore implants, profit from implants, and patient communication. This implant companion is yours to have for life, 5 hours for life as a learning resource. We've also added in 4 hours, 4 one-hour CE on TV shows where you get to watch in on a prosthodontist who places and restores his own implants. How to work with a dental lab, so important. You can plan a case, place an implant, go to restore it, and if the lab does not do a good job, it's not a success. How to extract and bone graft teeth, what GPs can do to get started extracting and bone grafting teeth and building their own implant site. All of this will be wrapped around patient communication, what codes to use. Most important, how to talk to patients about finances with dental implants. So the Fundamentals of Implant Dentistry has the 5-hour implant companion, Own It for Life, the 4-hour live CE on TV show that will help any dentist at any age or stage learn how to do more of this, get their team involved, learn what to do and what to refer. You can bond with your specialists over this. So you take this, the 5 hours, 4 hours of live CE on TV, you get access to the recordings for life. So this is an awesome program to start your journey or to make your journey a little bit better so you can make more money, do patient-centered production in a fun way with your team. Now, I know my dentist people, you guys often have questions about the question. You're often worried someone is trying to scam you, even if it's a good scam. Someone is trying to take advantage of you. Well, watch this. It comes with a Nacho money-back guarantee, just like one of my favorite stores, Nordstrom. If you get the 5-hour companion and you do the CE, and you do the 4 hours of live CE on TV with the recordings and do that CE, and if for any reason at the end you don't like it, just ask us for your money back, and we'll give your money back. You won't get to keep it for life then, but you get to test all of it out. I want you to use it. I want it to make you a happier dentisting human. It's a crazy time on earth with the coronavirus crisis, with the pandemic. What we can do for patients who need our help is get them to move forward with momentum on patient-centered treatment planning. It starts with case acceptance and then delivering this type of care, especially extraction bone grafting. If you're an associate and you want to do more work, produce more dentistry, learn extraction bone grafting. If you're a dental student who wants to get a better job, learn extraction bone grafting. Here's the why. There's so many practice owners that would love to refer some of their extraction bone grafting to an associate in their practice. They would love if an associate can offer that in a responsible way to do that in office and in-house. Still refer out to specialists when need be, but do more in-house. This is what this course is going to teach you. So to sign up, to learn more, just email us at salsa@dentalnachos.com, text CHIPS to 215-543-6454. Text CHIPS to 215-543-6454. We also have a special discount code, which we'll put in the comments here. You can save $50 on any of the 3 options before the deadline. So I hope you think about this just like a menu, see how it will help you. Even if you decide to do nothing with this, we can still be friends. But I encourage you to look at Fundamentals of Implant Dentistry as an investment in yourself. Dentists wish they could go back and invest in themselves earlier in their career. Patient communication, systems, codes, all wrapped around clinical care. Your dentisting core, how to do things clinically with your hands, how to talk to patients with your words, and how to make decisions with your mind. So if you have any questions for me, please reach out to me. I'm so excited to get this started. I want to thank Tyler Tolbert for inspiring me to do this at Dental Nachos. And I